Helen, Chair Belanca, you can take it up when you are ready.
Okay, great. Good morning, everyone. Welcome to the January meeting of the Universal Health Plan Governance Board and Happy New Year. I'm Helen Belanca. I'm the chair of the board. Katie, can you start with the roll call?
Yes, absolutely. Today's roll call question is what is something that you are looking forward to in 2025? So we will start with Chair Belanca.
Present, and I'm looking forward to a really cool trip to the South America that we might be taking later in the summer.
Wow. Thank you. Vice Chair Judy Richardson.
Good morning, I'm here. I'm looking forward to warmer weather. I know that's really simple and silly, but.
Chenwei Chi.
Oh, I just got another invitation to give a speech for a conference in the summer, so looking forward to that, but also looking forward to making more progress for this board.
Amy Fellows.
Hi, I'm looking forward to a conference I'm helping plan in August for the Youth Intellectual Developmental Disability Mental Health Summit. And we've secured an exciting keynote.
Michelle Glass.
Good morning, present. And I am looking forward to a productive Oregon legislative session and some time with family over the summer.
Bruce Goldberg.
Present, I'm in the here and now. I'm looking forward to this coming weekend. And I really am going to San Francisco to visit my daughter and grandson.
Cheryl Ramirez.
Present. I'm looking forward to a couple of conferences in March when I'm going to DC, and May I'm going to Philadelphia and I get to see my friend.
Thank you. And then we don't have Debbie today. She has previous engagement. But other than that, thank you and welcome all.
Great, thanks, Katie. As always, the board thanks the member of the public who took the time to submit written comments. We have a number of them this month, and I hope all the board members have had a chance to read through them. There's some really interesting comments in there. Excuse me. Chava Rutherford commented on our plan to use pet benefits as the basis for the Universal Health Plan, noting that pet beneficiaries are usually healthier than other populations and that might affect costs. Eve Chambers expressed support for our work. Kay Fior also expressed support for our work, in particular as it pertains to the high cost and hassle of getting the medications her family needs. Haley Hurt asked us to consider changing the global fee for maternity care to ensure that private practice, birth center, and home birth practitioners were adequately reimbursed, and advocated for better mental health reimbursement. Alessandra Rothstein, apologies for my pronunciation, encouraged us to include dental coverage in our plan. David Bernal wrote with his concern that his medication may not be covered by our plan. Kathleen Zinno advocated for better coverage of complex and rare diseases and noted that consolidation of healthcare institutions will impair access. Bruce Thompson asked whether our finance and revenue and operations committees are working together to build a public trust and to pay the clinicians and a public corporation to govern the plan. Christine Zintner recently resigned as a member of our plan design and expenditures committee. And she wrote a detailed email about why she resigned that I encourage you all to read if you haven't done so yet. I asked her permission to include it as public testimonies, and her concerns with that were that we were trying to build a plan without a budget, that we would not allow other types of coverage other than this plan, and that a single state-based universal healthcare model is fundamentally unattainable due to the high taxes it would involve and the fact that it may draw people from around the country who had high healthcare needs. She's an ERISA attorney and also feels there is no way to avoid an ERISA challenge, and detailed her other concerns there. Thomas Pike urged us to prioritize mental health as an essential component of the plan and to increase access to services. And Lito Ozeeta wanted to call our attention to the high rate of suicide among men in Oregon, which is 19.3 per 100,000, and asked how our plan will address the mental health needs of men, especially young men, and ensure they have the support they need. Again, the board appreciates hearing from all of you. We definitely read all of your comments and incorporate them into our work. So we have an important business item on our agenda today. As all the board members know, Morgan has accepted another position and has resigned from her role as executive director of this board. I think I speak for all the board members when I extend my deep gratitude to you, Morgan, for your work in getting this board launched. And we wish you well in your future pursuits. The main task we need to complete today is appointing an interim director and deciding on a process for hiring a new executive director. We have about 25 minutes allocated for that, but it may take more time as there are a couple of complicated pieces to that, so have some flexibility in our other agenda items. That's our biggest priority today. After that, we'll have some committee updates and a detailed discussion with the community engagement and communication co-chairs about their work, and if we have time, some discussion about our overall strategy. And with that, we can move on to our minutes. Is there a motion to approve our December minutes?
So moved.
Is there a second?
Second.
Any discussion? We can do a roll call.
Okay, Helen Malonka,
Yes.
Chen Wei Chi,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Abstain.
Bruce Goldberg,
Approved.
Judy Richardson,
Yes.
and Cheryl Ramirez.
Yes.
Great, thank you. I believe there is no public comment, so we will move on to the executive director report. I'll hand it over to you, Mark.
Great, thank you. First, before I dive into my report, I do want to thank you all for the opportunity to serve you in this role. It has been an amazing journey, and I'm really thankful for the opportunity to work with you all, support your work plan development, and really kind of get this board up and running. And I wish you the best of luck in in accomplishing the goals that you're setting out to do. So thank you so much. That I will jump in and just share that, you know, my primary focus for the last week, 2 weeks, and will be for the next week, is to do what I can to continue to support the board and develop a good transition plan. I've been working with the committee chairs for the 2 committees that I'm the primary staff person in, to make sure that we're planning ahead for 2 meetings, and that there's a good plan looking forward, and that the staff is working on getting the materials and supporting those committees, so that while the interim ED and your work that will happen, you'll be set up for success for those committees. So that's been my guiding light. In addition, I'm working on a transition memo just to support the interim ED and the new ED, to make sure that they have the context and some background and information as well. So that's been a primary focus for me. With that, there's still a couple of other updates. I'm really happy to share with you that Governor Kotek has submitted her recommendation to fill the vacant public engagement seat. She has nominated Mary Lou Henrich for that seat. This recommendation will go to the Senate in February, and will be subject to the Senate confirmation. And hopefully she'll be able to join maybe even as early as the February meeting, depending on the paperwork, but for sure the March meeting. In addition, I've been working with Katie and the communication folks here at DCBS for an update on our website. We have been getting, and primarily Katie, but we've been hearing lots of questions from the public about when the committee meetings are and how to find committee materials. So there will be an updated calendar, so people can look at one place and see what committee meetings are going to be happening that week. And hopefully that will be really helpful for just helping the public understand what's happening week by week, and they wouldn't have to go and search out, like, I want to know about the operations committee, or I want to know about a specific committee. They could just look and see what they might want to tap into. So kudos to Katie and the communications folks here at DCBS for that update. If all goes well, it should be launched early next month. And then, of course, I'm really happy to report that the RFP for actuarial and economic consulting services has been posted. This is the big RFP. It was posted on January 6th. It will be posted for 30 days, so it will close on February 7th. will be an RFP. We talked about it last month. We're still on track, if everything goes well, for that, to have that contractor on board in April. And we would need to move quickly to make sure that we have an evaluation committee set up and ready to go, as that evaluation will happen prior to the next board meeting.
So, the board remembers, we pulled out the revenue support as a smaller contract. That RFP is active and posted, right? Any updates on that smaller one?
Closes tomorrow.
Closes tomorrow, okay. And we have an evaluation committee for that RFP and contractor. But this is the bigger piece of work that involves economic analysis and sort of the full actuarial analysis of the plan. It'll be quite a bit more extensive. And we need an evaluation committee to review the applications that we get for that larger RFP. The board recalls for the smaller revenue one, we have several board members plus two members from the Finance and Revenue Committee are sitting on that evaluation committee. We were considering for this one to have whichever board members would like to participate in the evaluation committee. And then possibly a committee member from plan design and from finance and revenue if they were interested as well. So certainly Judy and I will be on that evaluation committee. The interim ED, or if we have a new ED by then, would be on that evaluation committee. Are there any other board members who want to be on the evaluation committee for that larger RFP? Bruce, you're on here. Okay, Bruce will be on it. And then Cheryl, you have a question?
I have a question. So I had volunteered for the revenue RFP evaluation committee, but then it got scheduled and I couldn't make the meeting. So for me to be able to say, yes, I'll be on this committee, I'd need to know when the meetings are first.
Okay.
Or maybe if there's a possibility of a doodle poll or something like that, because
Yeah.
I just couldn't get out of the other meetings I was in.
Yeah, absolutely. Yeah, let's, we will work to make sure that Cheryl, would you be interested in being on this larger one? Then,
Yes, if I can make it work with myself.
okay, we'll take note of that and make sure that happens. Any other board members interested in participating on that evaluation? Okay, great, thanks.
Great.
Anything else, Morgan?
Nope.
Okay,
Thank
thank
you.
you.
Helen?
Yes.
I had an issue, I don't know if it's apropos of sort of RFPs and budgets and all that. I don't know if now's the time to bring it up or later in the meeting around strategic direction or.
Yeah, go ahead now.
So I know it's great, we've got these RFPs going out. My sense is we're gonna need some more support in the years to come. The communications folks are gonna need some. I know that we're gonna need some on the operations committee. I know we've talked about having committees let us know about what their budget needs are. I feel like the legislature is starting, it's gonna be over before we blink. And what we need to do is come up with a budget that we need. Because right now, we're set, we have a budget that's going forward in the governor's budget, but that just seems like a number. It doesn't seem to be a budget that's based on what we as a board think we're gonna need. So I'm just wondering, can we get a process going so that we can actually establish what we need and get that to the legislature ASAP?
Yes, so our plan was to have all the board chairs submit budget numbers by February. By our next February meeting. So if we can, we'll reach out to the board chairs in the interim and ask you to think that through about what your budget needs will be.
So have it before the February meeting, at the February meeting?
So we'd like to approve it at the February meeting. So yes, so we can review it and talk it through before then and then have it ready to be approved at the February meeting.
Okay. So we should all get you something February 1st, February meeting. I'm just trying to
Yeah.
get some clarity
Yeah.
about when this is gonna happen. I just feel like it's been a little loose.
Yes, so February 1st would be ideal. I think, I need to look at my calendar here for when the meeting in February is which day? Maybe, do you know,
What's that?
the date of the February meeting?
It is the 20th.
Okay. So what is, so
And if it was any materials that would need to be posted to the website in advance, we need by the
the
21st.
6th, by February 6th, which is 2 weeks before the meeting, if we could get the budget numbers.
I love it.
Okay,
Thank you.
yes. Any other thoughts, questions? Okay. So next, we're going to be talking about the executive director hiring process, and we have some guests here with us today. I'm going to invite DCBS Deputy Director Sean O'Day and Courtney Dominic, is that right? Who's from HR to talk to us about the process.
All right, good morning, everybody. As the chair said, I'm Sean O'Day, Deputy Director for DCBS. Thank you, Courtney. I'm also colorblind, so I can never tell when these things. So I'll repeat for those who may not be able to hear online. Sean O'Day, Deputy Director, DCBS. Pleasure to be here and work with you today to help you navigate the variety of choices and decisions in front of you relating to 2 personnel actions. Chair noted at the beginning of today's meeting, which is to decide how you're going to go about filling the executive director role on an interim basis, as it is highly unlikely that you'd be able to select somebody to replace Morgan before her departure date, which I think is just next Tuesday? Thursday, that's right, week from today. So, and then the second decision for you is to decide how you want to go about the recruitment process itself. There's a couple of considerations going into this, 3 big areas that will govern the process that the board goes through. The first thing for you to know and understand is that the legislation that set the creation of this board and created the position of the executive director expressly states that the executive director serves at the pleasure of the board. Now, initially during the ramp up of the board, the position was reported to the governor and was selected by the governor until the board was seated. But upon seating of the board, the position becomes a direct report to the board. And that wording of the board is really important. What that means for all of you is that any employment related decision related to the executive director, whether it be the appointment of an interim or the selection of a successor, is that it requires the full board acting as a body to make that decision. In other words, not any one single individual has the responsibility or the authority to make those decisions. Instead, it must be the full board acting as a body. Now, one of the choices you have, which we'll talk about a little bit later today, is you can always delegate your authority to a subcommittee or to a particular individual. That is a legitimate choice, as is a legitimate choice that, nope, as a group, you're going to go through the process together. The other big area to talk about that governs this process is that because we're a government entity in the state of Oregon, there's a personnel process that we have to follow, which is why I have Courtney with me here today. Now, one thing to note is that this position, although subject to ORS Chapter 240 and the rules and prescriptions that are within that statute for public official hiring, it is considered an executive service or unclassified service position, which means that you have more flexibility as a board in how you design the recruitment process. And then finally, the other third area to note that governs today's decisions is the public meetings law. So should the board decide that it wants to go through the selection process as a body or delegate to a subcommittee, both this board and that subcommittee would be subject to public meetings law, which means that the process has to be done in a public meeting. The public meetings law also allows this board or a subcommittee to meet in executive session to do various parts of the process, such as interviewing candidates, deliberating the merits of different candidates, and selecting who would go to the next round in an executive session, so long as the board adopts the process, the criteria and standards by which the selection will be made, the position description in a public meeting subject to public comment, which is why you have this agenda item on today. Also, although a direct appointment would be something that is allowable as a executive unclassified position, if you are going to be meeting in executive session, the public meetings law also requires that this board publicly advertise the position for the recruitment. Which means that if you were thinking of a direct appointment, which I'm not sure that anybody is, it means that that full process has to be done in an open public meeting. With us today is Jake Gill, who is our assigned DOJ counsel. He's here so he can answer any public meetings law related questions that you might have. And before I move on, Jake, was there anything I said that you disagree with or that I might have gotten wrong in walking through those different legal considerations that govern the process and the decisions in front of the board today?
No changes or recommendations other than what you've already stated. Thank you.
Thanks, Jay. Appreciate it. Appreciate you being here. All right, Madam Chair. So that's the opening report for what you have in front of you. I'll turn it back to you.
So our first step is consideration of an interim executive director. And I want to open up the discussion to the board members if you had any thoughts or considerations. The vice chair and I and the staff have sort of talked through some various options. We have an option of a rotation within the state government, advertising position and having somebody who's already in state government rotate into the position on an interim basis. But the most logical explanation to us would be to have Jenny, who's already on our staff, step in as interim director. If anyone has any thoughts, concerns, preferences about that, now is the time to make those known. Yeah, Bruce.
No concerns. I think that's a great choice. I would just say that I think what's going to be most important about this is timing and to have the process be as quick as possible to hire someone. And so I think that's great if interim is really interim and really short. And that's what I hope our discussions and our work going forward will be, to move what can be a very slow process forward very quickly.
Yeah, that's been our priority too, is to think of it as expeditious of a process as we can.
Because we're in doing that, we're not only appointing an executive director, but we're losing one staff member. And so I think we need to balance that.
So I'll just echo what Bruce's comment because all of this work is going on simultaneously and Jenny is willing. I would even make the motion to appoint Jennifer Donovan as an interim executive director as we go through then the second step.
So Judy, you're making the motion. Okay, Judy's made a motion to appoint Jenny Donovan as our interim executive director. Is there a second? Is there any discussion?
Just be curious if in your talking about this, you had any other ideas or thoughts.
Well, the rotation was the biggest one. So we talked about, there's the option to post the position as have somebody rotate from somewhere else in state government. To your point that we'd be losing Jenny as a staff member, one of the ideas was the executive director has the authority to hire the staff. And so we could rotate somebody into an OPA position, the policy analyst position. That might be easier and more expeditious than trying to find an interim executive director. So if we were to appoint Jenny as our interim executive director, then we could probably bring someone quickly.
I like that plan. That makes sense. And I think rather it would take some time to get someone up to speed as an executive director. So that makes sense to me.
Yeah. Sure.
I'd love to hear from Jenny.
Yes. I was gonna ask her. I was gonna ask her to come. Jenny. Okay.
Here.
So yes, I spoke with Helen about this previously. It's not a surprise. And I am certainly willing to step in as the interim during the process. And we spoke also about the potential for rotating in an OPA, an operations and policy analyst, which is the position that I currently serve in, to serve as an interim senior policy analyst for the board while that hiring process goes on. After the hiring process is complete, I would just step back into my position, doing a job rotation. The person who had stepped in briefly would step back into their position. And then we would have a new executive director. And I think that that's probably the easiest process to get someone into my position rather than trying to rotate in on an interim, an executive director. And I'm happy to answer questions.
Did anyone twist your arm?
No.
You don't have to.
No.
Any other discussion? Go ahead, Amy.
Michelle.
Oh, Michelle does too. Yeah, go ahead, Michelle.
Thank you, Chair. I'm probably going to say something similar to Amy, perhaps. Jenny's been the staff support for the communications and our community engagement and communications committee. And I just wanted to say that I think that she is a consummate professional and is always on top of tasks and is really up to speed and has been very involved in the operationalization of our board work plan. And I think is a great pick for an interim. I really support this direction, and I'm grateful, Jenny, that you were willing to step into this huge role temporarily to help us out. So,
Amy, go.
Yeah, I just want to say I strongly agree that this is a great process, and I'm sure Jenny will do a great job. And I also, I don't know that we need to talk about this, but I assume that there's a process for while Jenny's in that interim that compensated in a different pay grade. Okay, just want to make sure.
And Cheryl?
I also agree on this plan but Michelle sparked another question for me. So with Morgan leaving, who will staff, namely the finance and revenue committee and the plan design, I think is the other one you have staff.
Right, so go ahead, do you want to take?
So the things that we've talked about thus far, and until, you vote and decide that I am the interim, I don't think that we've had a full plan, like definitely operationalized. But the idea would be is that I would retain the two committees that I currently have and take on support of the finance and revenue and plan design, which is why Morgan's been working so hard to ensure that she has meetings planned out in advance. So really, I'm just stepping in to administrate, not really help you design the agenda for those meetings. And then with the support that we have for policy analysts at OHA, we continue to have the two policy analysts at OHA to help with that work as well. But I would step in to actually help facilitate and administer the committees until we could get another OPA in my position.
I think that that's why I've been so focused on making sure there's a good plan to support the two committees so that when that new OPA job rotation comes in, there's some materials and transition documents and agendas already kind of in the works to support that job rotation.
Any other discussion? Okay, there's been a motion and a second to appoint Jennifer Donovan, and Katie has hopefully clarified that that would be effective January 24th, 2025. That's because Morgan's last day is January 23rd. And we can do a roll call vote.
Okay, Helen Blanca,
Yes.
Chenwei Chi,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
yes.
Bruce Goldberg,
Yes.
Judy Richardson,
Yes.
and Cheryl Ramirez.
Yes.
Congratulations, Jenny, I think. And thank you very much for being willing to step in the role. We appreciate it. Okay, our second objective is to review and approve the position description for the executive director. We have to be cautious when we do this because if we make significant changes, that will disrupt the process and require a review by DAS, if that's right, John. Yeah, so we would, if we make any significant changes, but I've sent the position description out to all of you. I hope you've had a chance to review it. We had some small edits, and Katie can pull those up. Did anybody have any other edits that have not been sent to me already? Yes, sure.
I don't have an edit, just a question for Morgan. Do you think these are about the right percentages of time for each of these duty categories?
Yeah, I think the position description as it currently is like 70% of most of the things that you do and all of the policy work, and then it's 20% for staff management and 10% for other. I think it could be more specific, but I think that those big percentages are 70% of my time is spent in other things besides staff management and other duties is correct.
Okay.
Madam Chair, if I may, just to provide the board some guidance for the discussion. So from a state personnel class and compensation perspective, you do have the latitude to make changes to the position description. Some changes, which is your prerogative, could trigger a DAS re-review of the position description to determine that it is at the appropriate classification and compensation level. Be a little bit more granular about that. Any sort of small tweaks to the duties really wouldn't trigger that type of review. A reallocation of percentages, however, would under the state personnel policies, as well as the minimum qualifications. So if the board looked at the minimum qualifications and said, wait, we don't think that's just quite right, any change to those would also trigger a review by DAS. The one area where the board has the most latitude, however, is in the area of the position description titled requested skills, which to help translate that is really as we mirror and bring the public meetings law overlay into the recruitment process and your review of the position description. This is really where you want to see your desired qualifications and attributes for the candidate reflected. And changes to that area does not necessitate a review by DAS. So again, everything is on the table. You can reallocate percentages, you can change the duties, depending upon the scope of those changes could trigger a review by DAS. And once again, I've got Courtney here. If there's something in particular you're thinking of and want to get on the spot advice, I know Courtney is happy to assist with that. But really the requested skills, which reflects the board's desired qualifications and attributes, that's where, I would encourage you to put most of your attention.
Thanks, Sean. Are you able to pull it up?
Yeah, do you want me to pull up Bruce's?
Yes.
Yeah, I sent in two. I didn't see them knowing what you sent back. So,
No, I didn't. I just sent what I sent you to the rest of the.
and I'm confident my two changes will not trigger a DAS review. They actually simply clarify what's in statute.
Great. Yeah, and I haven't seen your edit, so my comments weren't specific to this.
I will read them out loud. In section 3, program and policy management would change the following paragraph. Establish the overall direction of board activities and oversee the coordination of efforts towards the accomplishment of the board's legislatively mandated goals through directing the work of staff and establishing and maintaining effective reporting relationships. Change to read, work at the direction of the board to accomplish the board's legislatively mandated goals through directing the work of staff and establishing and maintaining effective reporting relationships.
Yeah, it just makes it clear what you had indicated. Yeah.
And then his other suggestion was, would change who reviews the work of the director from the governor's office to the board.
Great. And then, are you able to pull up the job description?
Yep.
To look at the requested skills section.
Still going down.
Yeah, to the requested skills, the section that John said we're able to change differently to the last page. It's the last one. So I think it's on here as it listed, Sean, as if the section listed as the additional position related information, is that?
I think it's located within that, yeah, requested skills.
Special requirements,
There we go.
under section 10,
Yep, special
Okay.
requirements.
yeah. Special mandatory, recruiting requirements. These are the ones that we can make edits to and that won't trigger a DAS review, right? Yes.
That's correct.
Yeah, so just,
It also reflects the board's desired qualifications and attributes, which need to be adopted in this meeting, again, to keep the door open for future executive sessions.
anyone have any thoughts, comments on those 6 special requirements? Yes, go ahead.
I'm wondering on number 5, I'm wondering, I don't know if the order matters, but it seems like that's critically important, but maybe also adding language about like understanding landscape of universal healthcare efforts in the US and internationally. Because I feel like somebody could have healthcare financing and healthcare industry knowledge, but not have a deep understanding of the mission of our work. And that's critically important. So I don't know.
So we could add on to that as well as knowledge of other efforts toward universal healthcare nationally and abroad.
Yeah.
Nationally,
something like that.
nationally and internationally.
Can you repeat that add-on sentence?
Yeah, so as in number 5, as well as knowledge of universal healthcare efforts, other universal healthcare efforts nationally and internationally.
Knowledge of.
National universal healthcare efforts and what was that?
Nationally and internationally.
Oh, okay. Gotcha.
National and international, yeah. Yeah. Good, thank you, that's good. That's good call. Bruce,
Oh, sorry, that's left over.
oh, okay. Did you have something?
Oh, no.
Okay, okay. Anyone else have thoughts or comments on these special requirements? Okay. Then we need to take a vote to approve this as our official job description for our executive director. Yes?
And are we all good to include Bruce's as well?
Oh, yes.
Okay, everyone
Yes,
agrees.
so I need a motion to include Bruce's edits as well as this edit to number 5 on special requirement, and approve it as our official job description for executive director. Is there a motion?
I move to approve the executive director position description with the board edits, and requested skills dated January 2025.
Is there a second?
Second.
Any discussion? Okay, we'll do a roll call vote.
Great. Helen Belanca,
Yes.
Chen Wei Chi,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Bruce Goldberg,
Yes,
Judy Richardson,
Yes.
and Cheryl Ramirez.
Yes.
Excellent. The third thing we need to do is talk as a board a little bit about the qualifications we are looking for in this position. If the board has any advice or additional information that we want to think about when we are recruiting for this position. And Morgan, I'd invite you to chime in as well if you would have any thoughts or comments on qualifications that you think would be, that the board should consider when we hire this position.
Well, I think in this list of 6 things, I think a lot of the ones that I would suggest are captured, the experience managing a board or a public body, facilitate meetings and support and committees. I think a lot of the work that I do is support this board and support the committees. And then with a knowledge of healthcare financing, healthcare industry and other healthcare or that universal healthcare efforts, I think that that's captures the subject matter and a lot of the responsibilities.
What about experience working within a state government agency?
Oh my gosh. I will admit not having state government experience and knowledge, in particular of the procurement system, has been an area where I've had the biggest learning curve. There are great people at DCBS to work with, but if you can find somebody that has all of that in state government experience, that would be a great addition and in support of this board's work.
I don't know that this needs to be an addition and what we just all voted on, but then after we started talking, it's inferred maybe, but there's nothing about like, am I missing about public policy experience or knowledge, policy piece?
Anything else?
I would just comment that, you know, the skills you want in a board, in an executive director are different now than you would want in 2 or 3 years. When, if and when there was something up and operational and there was a public corporation, et cetera, I think the knowledge and skills that you would want are very different from what you want in putting something together. I just think we're gonna have to deal with that.
Can you elaborate on knowledge and skills for now where we are with this board?
Yeah, we're building something. You want to have someone who understands policy and the environment. I think when you're running a $50 billion organization, it's a very different set of executive skills and experience that you would want. So, you know, I just think it's really different. The scope of the job is really different. Running something where you're responsible for hundreds of employees and billions of dollars is really different from when you're starting something up with 3 people and you're putting together policy and you're dealing with state procurement, things like that. Just think it's really different. And I want someone in the future with, you know, health systems management would be much more important than knowing about state procurement. It's just a very different environment. But we'll cross that, you know, hopefully we'll cross that bridge.
Any other thoughts on qualifications? Yes, go ahead, John.
Yeah, and in response to Bruce's question and comment, given that if we are successful in maybe 3 to 5 years' time, the universal health plan will be implemented, and then we will need someone with different skill set. With that consideration, should we set a kind of time limit for this position?
Less interesting.
That's just an open question. I'm not suggesting anything.
A good thing to think about.
Any other thoughts? Okay. Our next process is to decide on the actual process for recruiting. It's really important that we have this discussion in public so that we know which pieces of the hiring process will happen at the board level, at the DCBS level, or at any other level that the board decides. Sean, should I hand it over to you, or do you want me to go through these?
I'm happy to.
Okay,
Yeah.
I'd appreciate it.
Thank you, Madam Chair. And just as a point of clarification, so with those 2 other attributes that you just discussed, policy experience and then experience navigating the state administrative process, do you want those reflected in the position description and those other special requested skills? Can you pull in, Katie?
Yes. Pull up the requested or the position description again.
The last page of it.
I saw Jake come on camera there, and I'm assuming that was kind of where he was going to go with that as well.
Very good.
I think it would be useful to have them in there. I'd be in favor of adding them. So adding into these special requirements, experience in working within a state government agency. And then another one that would say, health policy experience. Amy, did you want to elaborate on what exactly that would say, or?
And Madam Chair,
Oh, yes.
one of the reasons why I brought the subject matter expert is
Yes.
she is just an encyclopedia of
Yeah.
position
Yes.
description wording.
Yeah.
She can help you wordsmith this. Go ahead, Courtney.
See those things.
So one of the recommendations, I guess, would be to not house maybe that language specifically in this position description, but putting it in the job announcement.
Mm.
And we can actually use wording in saying in the requested skills of the job announcement to say state government experience is preferred but not required.
Yes.
That
Thank
will-
you.
Yeah,
That
that
was
was the
where-
recruitment a little bit more.
That was
Yeah.
where I was going.
Okay.
When you make it mandatory, you're cutting out
You're losing-
a whole group of people who you might want to consider.
Yes.
Okay, great. And then the health policy.
You could do the same in the job announcement as well, instead of housing it specifically in the position description. But we could essentially recruit for that specific skill. That way, if someone does not have that skill, they could still be in consideration with the opportunity to learn it in the position.
Okay, great. Any thoughts on that, or okay with that suggestion? Okay,
All right.
okay, great, excellent.
Thank you for revisiting that.
Okay.
Just so it's crystal clear to the public and others, the will of the board. So as the chair said, the next agenda item is to then decide the selection process or method. I recommend that the board break this into two separate decisions because it'll facilitate the conversation a little bit easier. The first is to decide whether the board wishes to retain authority for all decisions in the hiring process, selection process, or delegate that hiring authority to a committee of the board, or delegate that specifically to the chair or to an individual member. If you go with that third option, then public meetings law would not necessarily come into play. Because that person would be acting with full authority and independent and operating very much the same way that we were as the governor's designated designee in the initial recruitment for the executive director position. So those all three options are on the table and recommend that you start with that decision because then that can guide what the follow-on discussion would be as to, all right, what are going to be the steps and process for doing the job announcement, recruitment, selection, and then ultimate board decision.
Question,
Yes.
does 3A, retaining the authority with the board, does that preclude having a small group screen and interview and come up with some finalists for the whole board to consider?
It's a very good question. So to be clear, when we say retain authority for the board, that would be for all decisions, including the final decision.
Right.
The B might be more of what you're referring to, where the board votes to select and nominate a selection committee that does that initial screening, meets with candidates, and then makes a recommendation back to the board, is what B would look like. And if I understood you correctly, that's probably what you're referring to.
Yeah, I was trying to.
Yeah.
Thank you.
It feels like option 3B, delegate the hiring authority to a committee of the board, strikes that sweet spot between being expedient as well as due diligence and having the board's authority to make a decision. So I would make a motion to delegate the hiring authority to a committee of the board.
Any second for that motion? Cheryl, second. Any discussion?
Yeah, I think I agree with that. But if we're all then agreeing that the final decision is made by the entire board, not by that subcommittee.
One of the processes that we've worked out for the board to consider is that if there's a subset of board members who are interested in being on a hiring committee, that group could work with DCBS and their recruitment services The DCBS recruitment services could help by posting the position, doing an initial screening for basic qualifications, getting a list of preliminary applicants. The hiring committee could review them, and the hiring committee could come up with 1, 2, 3 top applicants. Whatever that committee feels are, the most viable candidates. It might be just one, it might be as many as 3. And then present those candidates to the board with a recommendation. The board could have a discussion, and then make the final decision together. It wouldn't be that the hiring committee would be responsible for the final decision. The board would ultimately make the final decision, but the committee would do the work of the interviews and selecting a few final candidates. That's one of the things that we talked about as a process. Amy, go ahead.
And I'm just trying to think about the timing and like how fast, like if we decide today on this job description, how fast it will get posted, and then when the selection committee process. And also like a decision coming back to the board, would we potentially have a special board meeting just focused on that, because we would want to wait for our monthly, so that we can keep things moving.
So my goal is to get the process today, so that, exactly as you said, if we can land on a process today and get board approval for a process, then it could be posted, recruitment begin immediately, Morgan's still on board and can help with that. Yes, if we can get as much as we can sort of approved today, and then if we do have somebody, we could call a special meeting of the board to decide on an executive director, depending on the timing of when that happens.
Jake had a comment.
Go ahead, Jake.
Sure, just a reminder that a committee that is assigned to give recommendations, bring recommendations back to the board, would be a governing body that's subject to the public meetings law.
And so to flush that out, what that means is we'd be noticing the meetings well in advance, subject to executive session again, because the board's going through all those prerequisites here. And as you think about who would make up that selection committee, really recommend that if it both be people who have a personal and professional interest in the recruitment, of course, but also has a very clear schedule that we can then work with to schedule. I think you should anticipate probably meeting once a week to once every 2 weeks on the cadence for probably about a month. Generally speaking, depending upon how many levels of interviews you go through, we will do our best to structure this to look a lot like our other DCBS recruitments, for which we have a 50-day time frame imposed, and that is 50 days from the date that the job is announced and open to when the candidate is accepting the offer. We are incredibly efficient and expedient in this process. We meet that most of the time. Sometimes we're under that. That would be our recommended target time frame for all of you. But again, in order to achieve that, it means that the subcommittee will be meeting about once a week, once every 2 weeks, for about a month at a time. Or for a month total.
I should clarify that the board is likely to have the recruitment services of DCBS available to us at no cost. And as Sean said, they have a very expeditious process, which I think is in our interest. We could make another choice. We could go with the recruiting services of the Department of Administrative Services, or we could hire a private firm, both of which would add time and expense. So in our discussions, it seemed obvious to us to go with the DCBS recruiting services for both time and cost reasons. But the board has other options if we didn't want to do that.
And what I recommend is if we've got a motion on the table to create a subcommittee, that you first vote on who those subcommittee members would be. And then the next agenda topic would be to discuss, okay, what direction does the board want to give those members as far as what that recruiting process should look like, which I think Bruce gets to some of the discussion of what you're making.
So there's been a motion and a second. Is there any more discussion on this?
Yeah, I just want to clarify. When we talk about this committee and making recommendations to the board, I'd love an opportunity. I think we should have an opportunity for, if they want to, for the board to actually meet with those final candidates. It isn't just the group recommends them and we look at a piece of paper, but that there's an opportunity for the entire board to meet with and interview, whether that's 1, 2, or 3 finalists. And I think that's applicable under what you've laid out.
Right, that would be, and Bruce, that would be, you know, if you appoint a committee, you know, the kind of next step would be, okay, who's gonna serve on the committee? Vote on the creation of it, and then we'll come back and then as part of that motion is where you'd have that direction embedded in it.
And I love the timeframe. And I was gonna suggest that we have a clear, I was going with 40 days, but
Great. Is anyone interested in serving on this committee? I'll put my name forth as being on it for certain, considering of course what John said about the time commitment involved. Great, thank you.
I'd be happy to if you take me off of the, whatever it is I volunteered for before.
RFP.
The
The
RFP one.
RFP, yeah.
Okay. Excellent. Anyone else? Okay, so we have a motion and a second to establish a hiring committee consisting of me, Judy, and Bruce. Any other discussion before we take a vote? Okay.
All right, Helen Belanca,
Yes.
Chenwei Chi,
Yes.
Amy Bellows,
Yes.
Michelle Glass,
Yes.
Ruth Goldberg,
Yes,
Judy Richardson.
Yes.
And Cheryl Ramirez.
Yes.
Excellent. Okay, last step. As Sean said, we just have to walk through the process of what that would look like. We've thought this through and we have a recommendation, which we can put up. This is modifiable, of course, and in fact, it sounds like we already have a couple modifications from it. So I would add on here after number 4, or maybe before. So the board, well, let's say as part of number 4, I would say the board will have the option to interview finalist candidates in person and go into executive session to discuss the details of the recommendation. Oh, yeah, you put
It's
it.
there.
It's
I got
in
it.
there.
I
Sorry, I missed
anticipated
that.
that.
Okay, great. Thank
It's there.
you. Someone's ahead of me. Thank goodness.
Literally in person?
Yes, literally in person.
And the way that this is drafted is it gives the board discretion, once the subcommittee has narrowed it down to 1 to 2 finalists. And again, you know, Helen said, this is really just a starting point to help guide your thinking. This isn't, you know, where now, we're not saying this is what you would have to do. So the way this process is designed is that the subcommittee would meet and work with Courtney, and I'll turn it over to Courtney to talk through the recruitment process and the development of a recruitment plan. But when you get close to the end of the process, the subcommittee would identify 1 to 2 candidates, make a recommendation to the board to select one or the other. If there were to, and at that point, the board would have the option of either accepting and acting on that recommendation, or should you choose to go into the executive session and hold interviews with 1 or 2 candidates. So we wrote it in a way that you could make either choice in the moment rather than having to make that choice here today. And Courtney, would you mind just kind of talking briefly, you know, what this motion would do would be to delegate to the subcommittee the authorities to take all of these actions up here, to include development of a recruiting plan, to meet with, to review applications, select candidates, interview those candidates, and to decide whether to do another round of interviews to continue to narrow the candidate pool, or to, you know, make a recommendation at that point. So I'm going to turn over to Courtney. Courtney, if you can just kind of talk through those elements of a recruiting plan that, again, by this motion, the board would be vesting authority in the subcommittee to make these decisions.
So the first one, position description will be posted and advertised for 20 days. This will include that position description that was approved. And then would lead into the job announcement that we would go over together, indicating the requested skills that you are looking for. With the additional state government and public policy preferred but not required. We would then, with the 20 days that it is going to be posted, we would choose when that posting goes up and when it closes. while the position is posted, we would discuss where you would like the position advertised. We would pursue both free advertisements and paid advertisements if you so wish. We have a lot of accounts with DCBS recruiting that we would post automatically for you. This is places like Partners in Diversity, Handshake, which is through colleges and universities, iMatch Skills, which partners with WorkSource Oregon, and other various associations that we have accounts with. Then we would go through the selection process of the candidates. This would go 2 parts. First being the minimum qualifications. So every candidate that applies to this position must meet the minimum qualifications. Those are established by the Department of Administrative Services. I would recommend that you would have me do the screening on the minimum qualifications, and then I would provide you the final list of candidates of all candidates that do qualify for the role. You would then look at those candidates and then select who meets essentially the requested skills or desired attributes of the position and make a recommendation for who you would like to move forward to the round 1 interviews. And then we would determine the panelists, the questions for the interviews. You can do this various ways. You can do it virtually. In person, I know we would have to discuss that with public session. And then we would also determine if candidates would receive questions in advance to the interview or if they would receive them right on the spot. And then determine if a second round interview is needed. And if so, what that would look like. And then that leads to number 3. Hiring committee members will reach consensus on a recommendation of the top 1 or 2 candidates. Conduct reference checks. You would determine whether or not the committee would like to complete those reference checks, or if you would like to have our HR services complete those reference checks and then provide you with the outcome of those reference checks, and then present that to the board meeting. And then we discussed number 4, but bringing the final candidates to the board. And then 5th and final, the board will take a public vote on the selection of the final candidate and then delegating authority to chair to negotiate the terms of employment.
And again, not looking for the board today, the way this is structured, to make decisions on what is the open date, what are the interview questions, who are going to be the panelists. Instead, just want to make clear that by voting on this motion as drafted, you are vesting authority to make those decisions in the subcommittee, and we would be working with the subcommittee to help guide the subcommittee through that process. If there are any of these points that you feel like, no, as a board, we should be making those decisions, this is the time to make those adjustments. But this is a pretty standard process. I should have noted at the beginning, prior to coming to the state, had over 20 years of public sector experience in both legal and management positions with local governments, which are all governed by bodies, and so have been through this process countless number of times in those 20 years, truly more times than I can count. And this is the standard model that most city councils or other local government governing bodies will use.
Right. Thank you for that, and I have full hope and confidence in Brittany's ability. Does there need to be any language in here that talks about what happens if we have a failed search or if we don't come up with a recommendation?
That's a great question, Judy. If you have a failed recruitment, what we would advise is that the subcommittee come back to the board and give the board a status update and its conclusion that it does not look like we don't have any viable candidates after the close date, in which case, we'll be back talking about what to do at that point, but that would become a board decision, the way that this is drafted. And again, that's kind of the normal course for most governing bodies going through this process.
A couple of questions. With this motion, if the hiring committee, does the hiring committee have the authority to extend the recruitment for beyond 20 days under this?
Yes, but thank you. That's a great question, Morgan. The way that it's envisioned and drafted, because they are setting the open date with that, 20 days. Actually, what we could do just to make that abundantly clear, is Katie, if you don't mind, in the second paragraph, second bullet point, open date, and then input in parentheses, an extension of the closing date if necessary. That way that decision can be made at the committee level, makes it more efficient than having to bring that back to the board.
And we're not going over that 50-day limit.
Right, we will. We
You
will
can
help
extend
you.
it all you like, so as long as we stay within 50 days.
I did have the opportunity to speak with the DAS executive recruiter yesterday about their services. And a couple of things that we talked about that you also might want to clarify, and that was that, the hiring committee has the ability to screen or appoint to Courtney to do that minimum qualification screening, just be really very clear about, that that's authority that the hiring committee would have to decide who does that minimum qualifications screening. And also suggested, making sure that, in the motion following DCBS's policies and procedures for hiring was clear in this as well, so that it's clear what policies the board is following in that process.
So, in number 2, then, the hiring committee will work with DCBS recruiting services and adopt DCBS hiring standards or policies.
You could say both standards and policies.
Standards and policies. Okay, and adopt DCBS standards and policies. Sorry, DCBS hiring standards and policies.
And Madam Chair, if I can just suggest, instead of the word adopt, maybe use the phrase in accordance with.
Okay.
That way you're not, otherwise that suggests a vote,
Oh,
and it's
right.
gonna be the default anyways that we'd be following.
Okay, in accordance with DC, okay. And then to Morgan's point, do we need a specific bullet point under number 2 that delegates the minimum screening, minimum qualification screening to Courtney?
Is that one more ad? Sorry, what was that?
So, after the first bullet point of develop job announcement, a second bullet point would be, delegate, oh wait, it would be, yeah, recruitment sources.
It'd be right under recruitment sources.
Right under recruitment sources, a new bullet point that says, delegate, authority, to do minimum qualification screening. Like you want your name there,
Yeah.
to Courtney and Dominic.
Yes.
Courtney, can you spell your last name?
DOMINA.
Go ahead, John.
I have a clarifying questions regarding the opening date. It is a common practice in university hiring that sometimes in order to avoid having a failed search, that you have to start all paperwork all over again. They would put certain closing date and then another language or until the position is filled. Is that allowed in DCBS?
We have a policy that says any position that is open until filled, would need essentially approval. I would say that the board's approval we could add that language there. We do like to give that close date. So the reason being, we cannot screen candidates before the closing date. So it must close in order to begin that official screening. So it is a little difficult to put in close until filled, because that date is a very hard deadline for our staff to begin the screening process. So I would lean onto you of really what you would prefer. I would recommend giving a open date, close date. We could then choose to extend if we so wish, and we would just update that in the job announcement. But that way the candidates are very clear in understanding when the timeline is for the recruitment and what they can expect out of their experience.
Thank you. And if open until filled, what that would mean, and the reason why we don't use that as a practice and within the agency requires my approval, which I generally don't give, is because it invites some risk in the hiring process. And that if you are in your third round of interviews and a new application comes in, where you're now legally required to consider that. And it could really, mess with the process. Now it does, there are advantages to that. And there are times when strategically you want to make that decision because, it could be that you get a last minute excellent candidate. But again, on balance, for the most part, the better way to kind of weigh those equities is, as Courtney said, set that closing date, but retain, in this case, the subcommittee would retain the authority to decide to extend it should you find that you not have enough qualified candidates as of that date. And that brings more definitiveness to the process as to when things are going to close, and the committee is now going to go into the selection deliberation process.
Any other discussion? Okay, so we need a motion to establish the process as outlined on this slide to hire a new executive director. Is there a motion?
So moved.
Is there a second?
Good.
Any further discussion? Let's take a vote.
Ellen Belanca,
Yes.
Chen Wei Chi,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Ruth Goldberg,
Yes.
Judy Richardson.
Yes.
And Cheryl Ramirez.
Yes.
Excellent. Thank you so much. Sean and Courtney, thank you very much for being here, for your expertise, for your support of this board. We really appreciate it.
Happy to do it. Madam Chair, I might just suggest if you want to ask Jake if there are any questions or concerns that he has as your legal advisor with the process before we
Sure.
move on to the
before
next
closing
agenda item.
Yes. Jake, did you have anything to add?
No, I think the process looks great.
Thank you so much to you, Jake, for being here as always. Appreciate it.
Let the clock begin.
Okay, we are just a little bit behind schedule, but not a problem at all. So we're gonna move on to some committee updates. I think we will start with finance and revenue, and then if we have time, plan design, and then we'll take our meeting break. Cheryl, can I hand it to you for?
Sure. So the Finance and Revenue Committee has met once since our last board meeting. We decided to not do the supplemental meeting in December because of holidays, so we didn't have our usual second meeting. At our last meeting, which I believe was last week, is that correct? We approved a guiding document of revenue principles and attributes of a sound financial plan with agreed upon edits. We spent quite a lot of time in that committee meeting talking about it, so I think we're in a good place. We all agreed that this is a living document, so it means that we'll be tweaking it from time to time, depending on, the topics we're covering, so feel good about that. Just as a reminder, the committee agreed on a hybrid approach with the national health expenditures categories as a framework for the health expenditures part of our work. And we've been continuing to break down the health expenditures. One of our committee members is really working on that in earnest, and he reviewed where he's at on the spreadsheet where he's looking at total health expenditures and using a variety of data sources. At this meeting, he was focused on the MBS data and other public health expenditure data. And he separated out personal health care numbers. So we talked quite a bit about that. I think probably the most challenging thing about this hybrid approach is the time periods for the various data sets. So some of them are calendar year, some of them are state fiscal year, and some of them are federal fiscal year. So just trying to get the right numbers is a challenge, but we know we've acknowledged this and we're making sure we do this right. So the next step on the health expenditures side is to continue working on those spreadsheets. And it was acknowledged that the out-of-pocket and private insurance are going to be the hardest categories. And I think that's where our committee member and others are going next. And again, this is going to be an agenda item on all of our committee meeting agendas until we're done. So let's see. And also, we're gonna be working on administrative costs besides the out-of-pocket private insurance. So on the revenue, part of our responsibilities, we're going to have, I believe, Legislative Revenue Office back next week on the 21st is our next meeting. And we're gonna start talking about structural challenges, and starting by tackling ERISA, which I imagine is going to be a very complicated topic. So that's the next step. I brought back the suggestion that we use a different year to project, besides, we were talking about 2026. And the committee actually agreed after discussing when realistically the best year would be, and it seemed like the consensus was 2030 actually. So I don't know if anyone has any feedback on that year.
How did you come to that?
I believe it was that by the time, let's see, by the time we have the plan completed, it won't go into legislative session until like 2027. And then there would have to be a ballot measure in 2028, I believe. And so by that, then a final legislation in 29. I think that's how that discussion went. Morgan, correct me if I'm wrong. Okay. Let's see. There was a comment and we had some discussion about the state-based Universal Health Care Act that's been introduced in prior Congresses. And we're hoping will be introduced again in this Congress. And I think that's a really a good possibility for navigating the waiver situation. So I think there was some discussion about that. I'd like to know more about it. And then on the RFP evaluation committee for the revenue consultant, as I mentioned, I was going to be on that committee, but I had to step down because I couldn't make the meeting. So we've had 2 committee members volunteer, so I appreciate them taking my place. Let's see, I don't think I have anything else except to say that I'm going to have to step down from the plan design and expenditures committee because I just really need to focus on finance and revenue. I am helping a small group with the behavioral health benefits recommendations expansion, and we've met already, and I think we're getting close to being done with that. I think that's all I've got.
Does the finance committee have questions for the board or for other committees?
Yeah, thank you for reminding me. So some of our committee members are really interested in the waiver discussion that you're going to have in operations in February, right? And whether we need some extra joint meeting or not, I don't know, but the question that came up last time is whether we need a quorum of our committee in order to join a meeting of your committee. Was that the main question?
Yeah.
And I don't know the answer to that.
I think that there are a couple of members who want to join, but they also want to be able to participate.
Yes.
So if it wasn't an official joint meeting, would there be the allowance of the couple of members to participate? I think was the question.
Okay, thank you.
Make a recommendation,
Okay.
which is we haven't even started on working.
Mhm.
We've had an introductory meeting. I think to suddenly have a joint meeting would be a little difficult. What I'd recommend is if your members have some particular questions or issues they want, get them to us.
Okay.
And there'll be an opportunity to discuss things back at the board,
Mhm.
but I just think that may be the best way.
Okay,
It could, if they have particular questions,
Okay.
get them to me. We're gonna meet about waivers, I think, at the end of February.
Okay, I'll let them know that next week.
I would also offer that one of the pieces of support that we get from the Oregon Health Authority policy analysts is support on the waiver process. And I'm wondering if it would be useful to have some staff work on sort of a policy brief on the SABUCA, which is the state-based universal healthcare.
Yeah.
So the waiver process in general, just give an overview of that for both committees, for both.
That'd be really helpful. Thank you.
And then I had a question, would you be willing to share the principles document that was adopted with the full board and we could consider posting?
Yes, I know there were some edits being made.
Absolutely. Yeah, all right. And then any strong proposals?
Not yet.
Okay.
Yeah.
About 15 minutes before we're supposed to break.
Oh, Michelle has a question.
Oh, Michelle, go ahead, yes, sorry.
Thanks for this update. This is really exciting. It looks and sounds like finance and revenue is getting started on your work plan. And so you may not have an answer to this yet, but I was just wondering for community engagement and communications timeline and planning purposes, if you have had any discussion or if you have any sense of when you might have some items that you would want our committee to take out for public engagement feedback.
Not sure yet, Michelle. We're giving ourselves kind of a deadline to have the recommendation so that we could meet with plan design June. June is the deadline, but maybe we'll have something earlier than that. I mean, we're meeting twice a month, so maybe. But I don't have a guess yet. Do you have any, would you add anything more down?
I think that timeline that Cheryl just outlined, June, and while the joint meeting with plan design is the goal, and I think would be a good time to start thinking about community engagement.
Okay. And then I wonder if you might consider a straw proposal about your process for estimating health expenditures. You know, that's how you're gonna assess what the expenditures are. Just try to work through the process and see it and bring that back to the board of like what that would look like, what that hybrid process is.
Okay, thank you. I will do that.
Pretty cool. Debbie is the chair of plan design. She was unable to attend the last committee meeting, so I'm filling in for her temporarily. Plan design met earlier in December. We had great attendance and a lot of active discussion. And we focused this meeting on the benefits discussion. This is our second meeting talking about benefits, and the committee really wanted to dive deeper into understanding the differences between PEB and OEB. One of the things that we've come across in that committee that we are wrestling with is while the task force and this board and our preliminary structure have been in agreement about the idea of using PEB as a basis for our benefits, there are a number of benefits that are available to folks on OHP that are not available on PEB. And the question came up of how do we accommodate that? We don't want anyone who currently qualifies for OHP to lose those benefits. And so going with a strict PEB model would raises that question. So we dove deeper into some of those benefits. Those include non-emergency medical transportation, the long-term services and supports, ESPDT, which is the early screening, early and periodic screening, diagnostics and treatment for young children or youth with special healthcare needs up to age 26, and then health-related social needs. Those are all enhanced programs of Oregon Health Plan that exist for folks who meet the qualifications for OHP, don't exist at all under OHP. In addition, we talked about the differences between PEB and Oregon Health Plan on things like dental coverage, vision coverage, behavioral health services that were available. We kind of dove into the weeds a little bit about that. And what a plan would look like that would sort of optimize those benefits. One of the questions that we had for the board is that the committee seemed to land on this idea that if we have a universal health plan, that folks who currently qualify or in the future qualify for Oregon Health Plan would receive an enhanced level of benefit, meaning that everybody would be eligible for a universal health plan. But if you qualify based on income for Oregon Health Plan, you would also receive those support services of non-emergency medical transportation, long-term services and supports, and health-related social needs, that those would still be available, but would depend on an income eligibility requirement. So it would be sort of like a two-phase system. You're welcome to chime in.
The way that people currently, disabled children, qualify for OHP that are over income limit is through the Affordable Care Act. It's called the K plan. And you are able to qualify to get those services regardless of income. In the case of disabled children and I think adults through the K plan, it's currently just for who need services, DBS. However, Senate Bill 1557 that OHA is working through right now expands it to mental health. So I just want to.
So that eligibility for K plan is not based on income, it's based on disability status, is that right?
Yeah, and Senate Bill 1557 will expand it, this K plan nationally. Oregon never tapped into it, but there's a whole other part of K plan that is for severe and persistent mental health.
Right.
To get the same level of support to reduce institutionalization.
Right.
And have community care, so, and that's not income based either.
Okay, so we didn't discuss that piece. We're just talking about the ones that folks are qualified based on income eligibility are the only ones that we talked about. Yeah, go ahead.
So just a couple comments. One, I would just urge that when people talked about the PEB benefit, it wasn't strictly the PEB benefit
PEB plus.
only,
Right.
because the issue was you have to start somewhere.
Yes.
And I think it was a notion of starting with the PEB benefit as a baseline benefit, rather than starting from nothing
Exactly.
and building a benefit would take a year and a lot of expense. So I would just throw that out there that it wasn't, people shouldn't interpret the PEB benefit strictly. Secondly, my other comment would be, if we're going to do anything around having people qualify for anything around income, I would make it be simple and streamlined. Right now, there are many, many, many different income levels that qualify you for the Oregon Health Plan. Whether you're a child, whether you're an adult, whether you're disabled, whether you're blind, whether you're able-bodied. I mean, there are many, many different income requirements. I would just keep that in mind, and I wouldn't just off the cuff say Oregon Health Plan, because it's not a very simple, easy, or just system to navigate. And just to think about that.
That's great feedback. Thank you. Regarding your first point, I think the committee was pretty clear that PEB was the basis. What the committee liked about the PEB benefits was the utilization limits on various services as a starting point, as a way of thinking about sort of cost containment and what would be offered. But yes, sort of enhancing that.
I just wanted
Yes,
those listening and others to
Yes.
be, that we're all clear about that.
yes, it's.
I think there's been some miscommunication or
Right.
misunderstanding about that.
Yeah. Yeah, but it's a good starting point. It's a launching pad. From
And
which
that's
we
the work
build.
of the committee, is to
Yeah.
then figure out how to
we need
modify that.
How do we modify it, right? And so, so the question again for the board is, are we comfortable with an income-based difference in how the plan is administered to support non-emergency medical transportation, long-term services and supports, and health-related social needs for those who meet the income qualifications? We could, again, look at additional enhanced plan for those who meet the disability qualifications under the K plan, but that wasn't discussed at our committee, but we certainly could consider that. So, yes, go ahead.
I guess I'm trying to wrap my brain around, the reason the rules are different for those different populations is because they're federal rules, and how are we So the waiver would be like for scrapping the federal rule, like I'm trying to wrap my brain around that part, and I haven't been in those
It's not a waiver.
conversations. Yeah, so the waiver would be okay.
So, our committee is planning on bringing a straw proposal regarding this at our next meeting, so we can get into it in a little bit more detail, but sort of. What we were discussing is, do you do like the same plan for everybody, in which case, the cost becomes a little bit untenable? Do you do an enhanced plan for those who meet income qualifications? Do you introduce cost sharing for some populations, like, we have a lot of priorities that sometimes are in conflict. One of the priorities this board has said is that there will be no cost sharing in this plan. And then another one is that everyone gets the same benefits, and then that becomes a little bit difficult to reconcile. Go ahead, Bruce.
Yeah, I was just gonna make the comment about not jumping to conclusion about income. That my recommendation would be, and I know this is hard for the committee, is to, I would say, figure out how to deal with the fact that there may be different populations that need different benefits. I wouldn't necessarily just jump to income to figure out how to do that, number one. Number two, I just think we need to be really careful about language. When we say health-related social needs services,
Yeah.
In Oregon, that doesn't mean everybody on Medicaid gets those services.
Right.
Yeah.
It's actually a very small population of people. So I don't know, when we're saying that a certain population is gonna get HRSN services. One, I don't know what those services are. Two, are you saying everybody that there's some qualifications based on need? There's a limit or duration to that. I mean, there's a lot that needs to be sort of parsed out. And I just think we all need to understand that.
Yeah. We're gonna work on a straw proposal and bring it to this board and that's the idea of the straw proposal too, is we're gonna try and put something forward about how we think it would work with the benefit plan. And then get feedback from the board if that's the right direction, or if we need to go a different way. So we will bring something more formal, but that's the.
I just encourage people to be creative.
Yes.
Yeah.
Yeah. No, it's a great point. We have two small groups in our committee that are working on special topics. One of them is revision of behavioral health services. That was clearly called out by the task force and by this board as well, that whatever benefit plan we come up with, we would like to see improvement in behavioral health access. So we have a small group of folks working on a proposal for that, as well as a small group working on the issue of long-term care and how that would look in our plan. So they're going to be coming back to us with some recommendations, and you can look forward to seeing strong proposals on those as well. Yes, Amy.
I mean, I just want to say that I hope, like, there's a value of not people on Oregon Health Plan have more chronic illness and, like, not further sacrificing our most vulnerable Oregonians. There is a national, and I see in the state, push towards reinstitutionalization of emotionally developmentally disabled people with mental illness. And the things that K Plan brought to Oregon was allowing families to stay together.
Right.
And that is critically important to me. So.
Absolutely. We'll make sure to dig a whole lot deeper into it, but thank you for calling that to my attention. Yeah, appreciate that. Yes, go ahead, Michelle.
Thank you, Chair. This feels like a good time to just, I don't know what the status of this is with all of the changes in staffing and needing to figure out a plan for an interim executive director, but the Community Engagement and Communications Committee, one of our first work plan tasks was to do a scan of existing feedback from communities across Oregon about what people feel is working well, what is not working well, recommendations, priorities. And we, at the last meeting, I believe we brought that forward and said that we would have staff get that to plan design and expenditures And I think that it sounds like this is a great timing for that committee to look at that. So just putting it out there that if possible, that's something that we felt was important to honor the feedback that's already been given before we go out to collect more feedback due to survey fatigue and things of that nature. And there was some really rich context and recommendations. And I think that it might be supportive of the process it sounds like you're in right now.
Yeah, that's excellent. Thank you, Michelle. We'll make sure to incorporate that in the review. Go ahead, John.
This is just a suggestion that we look ahead. Some of the subject we're discussing across different committee involve one critical issue that Oregon deal with it 2 decades ago, the priority setting. And so eventually, I think to reconcile revenue versus benefit, we need to develop some mechanism of priority setting, which I think the community engagement right now will take a lot of action and responsibility. That is asking the community the difficult choice of what the community think are important services that need to be covered. But that is not an open commitment, because the more service community wants to be covered, they have to pay more tax. So it has to be balanced between more services covered and how much tax community are willing to pay. So this will be a difficult decision. Eventually, we'll have to deal with, and such decision will cut across all community. And so I just want us to think ahead that this is the big picture that Oregon deal with it in Oregon Health Plan. Now we don't have to reinventing the wheel, but we can do better than the 2 decades ago.
Any other comments? Okay, we will pause here and take a break for 10 minutes. We can come back at 10:15.
My update will be 1 minute.
Okay.
We haven't met since the last meeting,
Okay,
so
let's come back at 10:15.
just so
Thanks. Welcome back, everyone. We are reconvening. Roll call. No, okay. So we will pick up where we left off with Operations Committee update, and I'll hand it over to Bruce for that.
Oh, sorry. Very quick update. We have, as you know from our work plan, the Operations Committee got started later. We've actually only met once. We will be meeting again at the end. I reported on that last time. So and that was an introductory meeting. We'll be meeting again at the end of this month to begin really our work. We're starting with talking about and detailing what it means to be a public corporation, and we'll move on from there.
Excellent. Thank you. Any questions for Bruce? Okay, so now I will hand it over to Michelle and Amy for both committee update, and also I've asked them to go into a little bit more detail about the strategic direction and for community engagement and communications, and to get feedback from this group. So I'll hand it over.
Thank you, Chair. Good morning, everyone. Michelle Glass, co-chair with Amy Fellows of Community Engagement and Communications. So we're bringing you an update with some context and then some requests for board input. So we'll start with an information item, which is just where we are at in our work plan as one of the committees that got started sooner rather than later in the workflow. And then we have 3 items that we want to ask for your best thinking on. Next slide, please. So just to orient you, since there's so many parallel work streams happening right now, our completed work, which is what this slide summarizes, includes establishing our committee. So we have 14 members, and we've held 3 meetings in 2024, and we'll be having our January meeting later this month. We have done a scan of existing feedback, as I mentioned earlier in this meeting, not just of the Joint Task Force's final report, but of other types of community engagement that's recent from across the state that is relevant for our work here. That included community health assessments, regional health equity coalitions, community health assessments or community assessments, and some other related work. And so that we brought back to the board last month, and staff will be getting you a summary of that scan to support your work as well. We also have begun a process which will be ongoing, but we have established a process and have some good initial input on identifying strategies to engage with communities and stakeholders using existing structures and meetings. So we have compiled a list and we have a process for adding to that list on an ongoing basis. Next slide, please. So where we stand today is planning for, which is what you'll hear about in a minute from Amy, planning for that community engagement through our contract with Diana and Artemis Consulting, and really focusing that engagement on what the Senate bill directs us to focus on. And so we will be bringing you some questions today to help to hone what that engagement looks like and make sure that we're all on the same page in terms of how we shape that process. So that is our current focus. Next slide, please. And then what we have in the future, which we have not started yet, is developing a plan for general public outreach to engage throughout the Finance and Operations Committee's work. So taking what I was hearing earlier, taking those recommendations that may be ready this summer and bringing those out for general public outreach and engagement to get feedback on those, and then iteratively always bringing feedback that we are hearing through our engagement back to this body. So that is our community engagement work plan update. And I will pass it to Amy, I believe. Nope. Yes.
I thought you were doing this one, but I can jump right.
I was wrong. Okay, I'm going to keep talking to you. Sorry, you're stuck with me. So our engagement deliverables, so that was our work plan. Our actual deliverables are using existing mechanisms to understand existing feedback. So that's where that scan came from. That deliverable is complete and has been sent. And then we also have a deliverable around community engagement plans for business, healthcare industry, and healthcare consumers. So that strategic focused engagement, not the general public engagement. That's what we're currently engaging Diana and Artemis Consulting with right now. And we're asking for your feedback to help shape. And then our third deliverable on the slide is presenting workstream recommendations following each work stream to get feedback on recommendations prior to board review. So this is iterative. It's complete for deliverable 1. So we've had like 1 round of this, and it will continue as we complete additional work streams. Sorry, Amy.
The community engagement contract scope of work that we have with Diana Bianco, who I believe is listening in so that she can hear your feedback when we get to the next slide. I wasn't saying next slide, sorry. Is to assist the board staff and the community engagement and communications committee to create a community engagement plan that's focused on these groups that were in Senate Bill 1089. So that is our main focus and direction from the legislature. And then we can move to the next slide. So some of the questions and input that we want to kind of have discussion with you during this time is, what are the key components for success engaging these groups? What are your worries about the engagement process? What challenges do you foresee? What are your thoughts about balancing capacity limits with the desire to hear from many people and to be inclusive? Are there specific contacts, organizations, or associations that you think should be prioritized in this outreach? And is there anything else you want to share as we undertake this work? So I guess I would open it up and maybe we could go through one question at a time and kind of more.
And the groups that you're,
Do you want to see?
Do you have a series of questions?
Those are the questions. Oops, those questions.
yeah, and then the groups are listed on the previous slide. So
Yeah.
when you engage, so if you go back 1 slide, Katie. When you engage with employers, business organizations, healthcare, CCOs, CBOs, you're wondering what our questions are, like how we should focus your interaction with them.
Yeah, if you have thoughts about that based on your roles and experiences,
Can we go back to the questions?
yes, there's the questions.
And just for context, these are questions that Diana brought, or our consultant brought to the committee at our December meeting, and we had a full committee discussion. But I think Helen was also wanting an opportunity for you all to give input as well before we solidify any draft plans and move forward with that engagement. So these are the same questions that the committee discussed at our last meeting, and we're hoping to get any thoughts that you have in addition as well.
I hate to be dense, but these are questions for us,
For the
not questions that
No.
you're gonna ask.
These are questions that we asked our committee and got some feedback, and now we're asking you.
So,
And Diana, our consultant, is, I think, online, so she will be hearing
Oh, great.
responses to help further our work.
so this is true of all committees, but we're taking this on with community engagement first. With the idea that, our committees are large, they're enthusiastic, their task is complex. And periodically, our committees may need some more specific direction from this board when they launch on their work, to make sure that we're all on the same page and then they're not going too far afield from what we hope that they will do. So for instance, on this issue with community engagement, I think about, who we know will be resistant to the idea of a universal health plan, who thinks that it is not in their best interest to have a universal health plan. Large businesses that are self-insured, for instance, that would be one example that I would wonder about and ask this committee, how do you approach that group? What are their concerns? What would they lose or gain from the universal health plan? What can they tell us about what the universal health plan would need to provide in order to make it work for them and their needs, that kind of thing.
I think based on our experience in the task force, we need to do some very targeted outreach of some of those stakeholders, the businesses, self-insured, because we didn't have good representation in our focus groups with the task force. I don't even know that we had a listening session with small businesses or self-insured. I think it was really difficult. So I think we're going to have to do a lot of work in recruiting them to participate. I also think, and I said this early on, the feedback we got from the behavioral health groups was very skewed toward younger people, college students, because I think that's how they recruited the focus group members. We need to get to people of all age ranges and lived experience in the system. And that will take some targeted recruitment too, through, associations and through relationships that some of us have to get those people to the table. So those are just two examples. I do think it's not just putting out an announcement and inviting people. I think we need to actually go and invite people, talk to people individually or groups individually.
Yeah. I would say in terms of business, it seems like large businesses that are self-insured and then small employers who provide health benefits to their employees, as well as small businesses who don't provide health benefits to their employees. Like hearing from those three specifically is what I'd be interested in. And then to Cheryl's point, intentional outreach to a broad sector of folks utilizing mental health and substance use treatment services, not just an open recruitment process, but finding people from various settings who can contribute. I'm going to turn over this to Amy.
Yeah.
Amy's going to run the questions.
And then I have a.
So a couple thoughts. One, I agree with Cheryl. We actually did have a small business one, but it was really only attended by two or three businesses. Couple thoughts. One, I think it's going to be important that amongst those groups, we have some diversity of opinion. We had some groups where everyone was wildly in favor of everything. And then we had other groups where they were wildly not in favor with everything. So I think to have some balance of perspectives would be really important. Number two, I think it's going to be really important to be clear about what questions we're asking these groups. I think we didn't do a very good job with that last time. Our work with those groups went something like this. We presented them sort of the outline of the plan and said, what do you think? And I think the question for us is, what are some of the specific questions and feedback we want? Not all or none, but really getting some input on perhaps some key questions, whether it's about eligibility, financing, benefits. I think to Chunwei's point, talking about the trade-offs that we have and where they stand on those trade-offs. I think we need to really put some thought into, I'm most concerned about what we're asking. Because I think that's where we're going to get the most feedback. And I don't think we've really been clear with ourselves as to what is it we want from these groups. Do we want input? Do we want to just check a box? Well, I mean, I just think some of the folks we talked to were like, so what are you asking us? And I think that's going to be most important.
And yeah, and I think part of this with the kind of, so far we've been talking about community engagement. But when we've brought up communications and, Bruce, when you brought up like the messaging piece is part of like, how do we pose those questions? And then also where are we in the stage of the other committees to have something to share with them? Because we aren't going to get people to the table multiple times potentially. So the timing and the strategy around this is really key, and the messaging. And Michelle and I will be working on, with Jenny on creating a RFI for communications, but we need to make sure that we get someone who understands the context of our work and the importance of messaging and how people respond to words, how people respond to what Chinwe talked about in terms of like plan and taxing. And, those are conversations that if we don't have the right questions and messaging, we could do more harm if we aren't very strategic and careful about that.
And my understanding, correct me if I'm wrong, this is just one piece of outreach and engagement.
Yes.
We have a whole separate piece around consumers. Or do we not? Because that's a very sort of, I would say, industry focused group.
Yeah, they were listed as a separate. If you go back one
If you go
slide,
back,
we have, business healthcare providers, insurers, and the healthcare consumers, and then CCOs, CPOs, disability-led organizations.
So healthcare consumers is that broad public.
And that's
What's from SB 1089.
But that's part of the scope of the work we've contracted with Diana for.
Yes.
The list that's showing it's for contracted. Yes.
So Amy, I'm gonna let you finish questions because we're starting the discussion.
I think
Maybe first.
Helen,
Okay, I would just add with the business one,
Diana.
that the eligibility question is a really key one for the business community, how they manage eligibility for various benefits when they have remote workers, when they have in-state and out-of-state workers, if the company is based out of state and has employees in-state and vice versa. And then if we had a residency-based universal health plan, how that would affect them in terms of providing benefits across the board. I think that eligibility piece with remote work and interstate businesses is really key.
and then Diana after Jim.
Being in Oregon, I think we have the advantage and kind of obligation or responsibility to do this well in terms of community engagement, because Oregon was the world's pioneer to do that in the late 1980s for the OHP. At that time, before the establishment of the Oregon Health Plan, they went through at least 2 years of 2 iterations of community town hall meeting. They went through almost, not complete, but almost every county. But back then, it was less organized. Now, more than 2 decades later, there are many methods have been refined and developed. And 2 of the methods I suggest the committee to consider, because we are talking about targeted and more organized solicitation of communities' voice and preferences and values. So there are 2 commonly used methods, and one of my PhD students did that for her dissertation. And if you're interested, I can send you the paper. The paper has been published. So the 2 methods, one is more quantitative and use slightly larger sample for discrete choice experiment. And that's a survey, a comprehensive survey asking people, they had to weigh trade-off between paying more tax versus what kind of service they want. So they are already measured, well developed for that kind of survey. So people are not just asking a blank question, what service you like? Because you have to weigh with trade-off. If you want this service, would you be willing to pay more tax? So that's a quantitative method. called discrete choice experiment. And then another more qualitative method is called citizens jury. And citizens jury cannot accommodate large sample because the endpoint of citizen jury is to get a consensus or near consensus. And it allows the comprehensive survey to have participants again to discuss in depth. And for our purpose, we can have a general citizens jury organized for the general public, but we can also have a citizen jury organized for a specific group or for a mixed group. And one advantage of citizen jury is it allows participants or people with different or opposite opinions to understand why people or party are holding a complete opposite position. Because the end point of citizen jury is to get to a consensus or near consensus. And that consensus needs to be developed through mutual understanding and communication. Also, one advantage of citizen jury is before you engage the small group in that in-depth discussion, usually it takes hours. And it requires some budget because you need to pay people to participate because people need to commit at least one full day, sometimes more than one full day, depending on the subjects. But before you engage people in that in-depth discussion, you invite experts to present background information. So the general public, they are not engaging in the discussion without any prior knowledge. So there will be a prior session in which you invite experts to give information on the relevant discussion. So these are two methods I suggest the community engagement committee to consider.
Shunwei, would you have like 2 or 3 or 4 juries or just one?
Yeah.
I'm just curious.
Well, depending on the purpose, South Korea was the one on record that they have national health insurance. And in 2012, they were considering about 40 plus new drugs. Which of those new drugs the national health insurance should cover? So they committed probably the largest citizen jury activity on record. And eventually, they take on their conclusion to adopt most of the recommendation into their national health insurance policy in terms of which of the new drug their national health insurance will be covered. So depending on the purpose of the questions, it can be one jury for all parties involved. And you have to screen and stratify in terms of you have the general purpose is you recruit volunteers, but then you have to stratify those volunteers into the target, such as those representing each of those groups. But then you can also have a more targeted citizen jury on selected groups. So it depends on how much information we want to gather. And one specific question I ask suggests the community engagement to consider is about employers' willingness to contribute, because one of the issues we will be facing is when and if we implement this universal health plan in terms of financing, we will not only taxing individuals and families, but also potentially employers. So we need to ask employers, particularly the small employers who currently may not be providing health insurance. For the larger employer, they're probably relatively easier because they already contribute. But for the small employer who are currently not contributing, how much they are willing to pay tax in terms of if there's a universal health plan. This also relates to if we implement this plan and with our tax scheme, ideally, we don't want employees who currently receive benefit from employers to having to pay more than what they have to pay. Because in order to make that relatively neutral, we need the employer to contribute. So this will be a very complex question and communication for the community engagement to engage.
I just want to respond, and it would be great if you could share the papers that you're referencing. I also think it's really important that we reconsider the term citizen jury, which is a terrifying term in the disability community. And you know, kind of figure out if we do something in that model that we how we label it.
I also did another study in Chile. Chile also has universal health here, right? And it's a two-stage survey we did, one in 2017, one in 2019. So two-stage was first stage is a sample survey of Chilean population of about 1,200, asking them with the current universal health plan, what services you think should be priority. So that's the first stage we did survey. And I can share that paper. The paper has been published. And then based on that finding, what Chilean samples think are the top priority, then the second stage survey, we did a relatively innovative but simpler one than the discrete choice experiment. We asked them, give them hypothetical token money, because we want to equalize. We don't want the preference to be biased in favor of high income people. So in terms of the income, we want to neutralize. So give every survey sample the same token that representing money. And then we ask them to vote with that given token of money that among the priority they already identified, which priority they want to invest more money in terms of budget. So I can share those two papers with the committee and with the whole board.
Thank you, Diana. I see your hand up.
Hey, thanks so much, folks, for allowing me to participate. This is Diana Bianca with Artemis Consulting. And I wanted to jump in because I feel like there's a really important clarification point here. So what I've been asked to do is not a full-on public engagement strategy. That feels really important for folks to understand. What we've been talking about this as is as targeted strategic engagement. So there's 8 groups, and of those 8 groups, we have the capacity that's been sort of asked for is between 1 and 5 meetings each. And for all of them, we're not going to do 5 engagements. There will be 1 or 2 meetings. I think this becomes particularly relevant for the healthcare consumers. So I want to be really clear that the most number of meetings we can have with those healthcare consumers to get some of their input is 5. And so there's no way we're going to be able to, for example, engage. And I think, Cheryl, you're right on. We would love to hear from behavioral health consumers, you know, from all age groups with various experiences of the system. We don't have the capacity. In my contract, there is not the capacity to do that, and it's not what I've been asked to do. So I don't want folks to be disappointed when there's not broad consumer engagement, because that's my understanding, and I always welcome clarification, that this is not a public engagement strategy. This is targeted strategic engagement of these 8 groups with a pretty limited capacity of the number of meetings we can have and the number of folks we're going to be able to engage. And I'll stop talking in a minute, but that was one of the questions that was posed, is how do we balance that desire for input with limited resources and capacity? So I'm happy to answer questions. I'm happy to take additional guidance, but the direction that I've been given is what I've just shared. So, and we've had this conversation with the communication, the engagement committee with Amy and with Michelle and others and Jenny. Just wanted to really emphasize that, because I don't want people to have different expectations from the scope of this particular piece of work. And the last thing I'll say is, I think it was Bruce who raised this issue of, we need to have, and I said this to the committee recently, very specific questions for each of these groups. Not what do you all think, but really want those specific questions. So I'm happy to answer questions, happy to continue listening. Thanks for the opportunity to chime in.
Thanks, Diana. That was my understanding was this wasn't the large consumer engagement, that's gonna be a separate process. So thank you for clarifying.
For this
that.
contract for this year.
Exactly.
This is
For
the
this contract
location
for
that we
this
have.
year, it's going to be limited to exactly that. So thanks.
Yeah, and for the board, that's why the on the future work slide, that broad public engagement is not something we've even begun, right? It is future work. It is not current work of the committee. It is definitely not part of this contract with Diana. So we will be coming back to you for guidance for that conversation at a later date. And yeah, and we would love, this is a great feedback. I'm really appreciating this rich discussion. I've been taking lots of notes. So thank you for your guidance for this targeted outreach process.
When we come back next month with kind of future budget and things like that, you know, we'll have to consider what we need in those next 2 years, right? In terms of getting deeper.
Yep.
Like when there's something to actually share with, with the public, getting deeper into that, we'll have to consider that. Sure.
Diana, thanks for clarifying the scope of work. I think what I have in mind is if one of those consumer focus groups is going to be behavioral health, which I hope it will, that we target a broad, well, not just geographical, but demographic array of participants who have different experiences and it's very important to hear the experiences of people in college who are about to turn 26 or something, because that was a lot of what they talked about, losing benefits. But also of people who have had pretty long lived experience in the behavioral health system, all in one group together. I guess it speaks to your idea, Chenwei, of this citizen jury, that you've got a lot of people with different experiences in one group and talk, you know, so they may have differences of opinion even within that behavioral health group. So.
Got it, Cheryl. Thank you.
I think Judy, then Helen.
Thank you. As the committee talked about being explicit with those groups and for itself, with what's to be done with the information gleaned. If you're asking me as a provider group lots of questions on universal health plan, I'm gonna want to know what are you doing with that information? AKA, why should I bother answering you? And not like expecting, well, what we say is going to be, has it can be talked about.
We haven't yet, because we're still kind of at the beginning stages of, and, you know, we have to pose the questions and also the purpose of why we're inviting people and all of that. Helen.
I think the question of CCOs is a really interesting one. When you engage them, there's some allusion to the idea of regional entities in the task force report and some idea that maybe CCOs would morph into that role. And I'd be really curious to see how CCOs see their role in a universal health plan, if there is interest, capacity to expand, to what extent CCOs overlap with each other and share geographic regions. I think it's also really interesting to talk to the big players in the healthcare industry, the Providence, the Kaiser folks who operate in multiple states, how this would impact them in terms of their business model, and what they see as their barriers and opportunities for them with this kind of plan. Those are really key.
I think as we do that, I think we need to be careful about this not being a choice between status quo and whatever else we have as universal healthcare, that we probe about what are some of the issues and problems in our current healthcare system and how can those be made better. I think it's going to be important to hear some of that.
Right.
Are there other? Just before we move on, I just want to make sure there are other questions or comments now. I mean, this is just introducing this conversation, so we obviously want to continue to hear from you throughout the process. Okay. Michelle, this one's yours.
All right. Thanks, y'all. And please send any thoughts that occur later, via email. This will continue to be an iterative process. And so one of the things that we wanted to bring to you all is this question about intercommittee communications and requests. Since we have multiple committees meeting now, all of our work impacts each other. We are trying to think about how to create the process. It's hard to have enough time to create context for like, this is what we're doing. Here's where we're at in our work stream. This is where the opportunities are for cross-committee engagement or recommendations. But we need that process to be efficient, and we don't want to wait for monthly board meetings to do that all of that communication, because that seems like it would be too slow and cumbersome. So we're bringing a proposal, but we also would love your best thinking, either today or in future weeks around, would it work to have committee chairs send through staff clear requests, and maybe there's a couple of buckets. Either this is an information item that we're sharing, this is a question that we have, or this is a request that we have, between committees, between meetings, to facilitate that. And then maybe we could recap those communications at board meetings for everyone's benefit, but that would give us some kind of way of doing that in between these meetings. So do folks have thoughts about that proposal or alternatives?
Yeah, it's not clear to me, kind of alluding to our earlier discussion about timing, like, when is the right time, to provide that? Is this something that you want to be an open process that, just send you things as they come up and then the committee would decide on timing, or how do we know where we are? I think that's gonna be the most challenging part of our work, as we're all on these parallel processes about, what is the right amount of information at the right time? Do we just get it all to you and when it comes up and, let you sort it and time it as you see fit, or would you sort of request information from other committees? We're gonna be talking to the business group. What are what are the pieces of information from the other committees that we wanna talk to about them? Like, how would we organize that information?
Yeah, it's a great question, Helen. And I think this will probably be a living process that we'll have to make some modifications to as we go in terms of what's working and what's not. But the way that I would see it is, for example, the scan that the Community Engagement Communications Committee did, instead of waiting for a board meeting to report out that we've completed that scan, we could have, if this process were in place, we could have said, here's an information item. We recommend that you work it into your process wherever it makes the most sense and send it to the relevant committees. Then at the next board meeting, we could report out that we completed that work and sent it to those committees. Those committees could report that they received it and plan to consider it at X date, based on their work stream. Then everyone knows the status of what was communicated, where it's at in the work plan, but we don't have to wait for the board meeting to start those processes. So it makes us a little bit more nimble, especially when we're working with contractors who need feedback in order to move their scope of work forward in their timelines, for engagement and things of that nature. Does that make sense? And also, Amy, could you support with questions? Because I can't see well in the room. Thanks.
I don't see any further questions, and I think this also kind of ties into, was it last month, Judy, when you presented? So like kind of figuring out the processes that are communication stuff. So yeah, it's kind of trying to dig deeper into that. I don't know if people have further discussion on this, or
I would ask if there are things that people feel we want to start communicating now, are there things that we're ready to start talking about? With our interested parties that will be engaged, parent consultants, or we're not quite there yet?
I don't think we're there yet. Because again, I get back to. I'm not, I'm still not clear whether we're. Giving them some of, whether we're asking them for specific input on certain things. Or we're saying, here's what we're thinking, what do you think? Yeah, and I'm just not clear, and I'm not clear on the specific questions for each of those groups that we want. And I'm not saying that I want to, that needs to get hashed out here, but that's really the work of the communications group.
Yeah, is there a plan to work out those specific questions? That's been brought up several times, that we need targeted questions. Is that work gonna be done by the committee, or do you need support from the board or staff about that?
I think Jenny's gonna help us respond here.
I will jump in really quickly. And so in terms of the community engagement that we've contracted for that very specific direct targeted engagement with the specific groups that we've contracted with Diana for. Those questions will be worked out with Diana, with her assistants, to really look at, with her expertise, how can we make sure that we're asking the right questions? And that was one of her first questions when she started engaging with the committee, was talking about the importance of really targeted and good questions. So for that specific outreach, for the targeted outreach that will take committee, or I'm sorry, board approved committee proposals. And if we think back about the board process for decision-making that we looked at, I think the last meeting and the meeting before, that was sort of that process line where we had committees doing work, bringing that work to the board as a straw proposal, the board accepting that straw proposal and saying, yes, please go forward with this work and get more information. At that point, that's where we had talked about committee, or I'm sorry, the community engagement and communications committee engaging with those targeted groups about those specific design elements. So that's what we talked about previously. And we've engaged Diana for that specific purpose of talking to those very specific community groups about the plan design elements, not necessarily plan design in terms of the plan design committee, but design elements for the overall plan, and taking those out to the public in that targeted, focused way. Those questions would be developed with the help of Diana, with her services.
So I guess the question is, oh, sorry, go ahead, Michelle.
Well, I was just going to say, I'm hearing two different things. One is like, how is one specific intercommittee communication process going to work, and where are we at in the timing? And then this question is a little bit different. This is like, before we are in a crunch and we really need that process, can we establish a process, a general process for any and all communication and requests between committees? Or do we want to keep them only at board meetings and official report outs? That's kind of the bigger picture step back question. And so I'm just reflecting that we're talking about both of those things right now. So I want to keep those clear.
And on the first one that Jenny just spoke to in terms of Diana's scope of work and like drafting questions with input from our committee, I guess the question to the board is like, you know, how and when and where do you want to have input? Do you want to see the draft questions? You know, the like, just kind of thinking about that and thinking about timing and that process, because we're creating it now.
I'd love to see the draft questions.
Yeah, I would too.
In terms of, let me just ask a question. So in terms of the public meeting law, if you were to email us the draft questions, we probably can't provide feedback as a group. Is that right? How would that work? That's the only question.
Say that again.
In terms of like sending us the draft questions, the board in between meetings, It seems like we couldn't provide feedback. We just, how would that work?
Michelle has her hand.
I mean, if we were getting them to you so you could work them into your agenda for your committee meeting to discuss them, that would be a public meeting, right?
Yes.
So I think we wouldn't be just asking chairs for feedback on something that substantive. It would be communicating in a timely enough manner that you could work it into maybe that month's or whenever it made sense in your workflow meeting agenda to get to discuss with your committee and then get us feedback. And then a summary of those, where both committees are at in that process could be provided at this meeting, but we wouldn't have to wait for this meeting for each of those steps, right?
Okay, I think I understand. So the charge would be for us to bring those draft questions to our committees for their input that we would get at the committee. So I was thinking it was just us weighing in
I was
as
thinking it was just
board
us too.
members.
Yeah. But I mean, I guess we could bring it to the committees, but it depends on what group.
I think it kind of all depends on timing and where you are in your process and what makes sense and it's kind of,
Okay.
tricky as a hypothetical.
Yeah, if it was just for board feedback, it seems like it would have to come to a board meeting, as far as I can tell. This question, we may be too early, like the communications committee hit the ground running and we've already had some things to share. So this question may be too early for all of the committee chairs and the full board to consider, is what I'm hearing. Because this question is really, how do we communicate as committees? And it just seems like maybe that's not the most pressing question right now. Maybe we need to bring this back another time because I'm not getting a lot of feedback on this. And instead, it sounds like maybe there's some other questions we need to tend to instead. Like, how do we get full board feedback for important steps? And I hear really clearly that the board would like some input on the draft questions. So that's really helpful.
Sure, and just to help provide some feedback for you, we've gotten feedback on the job description. If you send out the questions to the board, and as long as there wasn't back and forth between the board members, but each board member provided feedback to staff could compile that into one document and give it to Michelle and Amy to take back to the committee. So there's definitely a way to solicit feedback in between meetings. And then what we did in finance and revenue was all of the committee members sent the feedback to me. I included all of that feedback in a track changes document, and then the committee went through that and saw everybody's edits. And I didn't do any summary. I just took them all and put them all in there. So then there was no discussion offline. It was just the ability to provide feedback. So that's definitely a mechanism you can use for something like that.
Thanks, that's helpful. Anything else on this discussion item? I know it's okay, you're fine, okay. Okay, so the last thing that we just wanted to run by you, that came up at our last board meeting. The idea of traveling board meetings as one way to get, community engagement and more awareness around our work. The proposal is to rotate every other month between Salem and other regions, maintaining remote accessibility for both board members and community. To send out local press releases ahead of the regional board meetings so that we get some attention and people, hopefully coming. And at this point, the starting date is to be determined because we do recognize that this is going to take a lot of staff logistics. Like, we have to make sure that whatever room you're using in the other city, has the owl set up and all the technology to do virtual meetings. And, things like the press releases and all of that. And so since we're in the middle of some staff transition, we want to be sensitive to not create more overload on staff, but kind of, do people in general like this idea? And then any thoughts about like when we potentially would start?
Do you have a list of like which cities you would propose we go to or which towns or?
Not yet, and we could work with our community engagement committee to maybe create that list and bring it back.
I want to make sure that the rule, I was gonna say that it fulfills the purpose, if the purpose is that we would have more community engagement and help folks be more aware, I don't want to go through all the work of getting people to a new location and setting something up remotely if we don't have sort of a community that is interested in engaging with us while we're there, right? You know what I mean? So to do it somewhere else, just to do it somewhere else doesn't make much sense, but if there are communities that really want to come in person, want to provide feedback, want to know about our work more, and it would be worthwhile. So I think it'd be a little bit of legwork to identify a few places like that, and not just show up somewhere without that pre-work done. So that would matter to me, because it'll involve a fair bit of travel for all of us. I would definitely still come in person, so we want to make sure that that was meaningful.
And then Chinmay and Michelle.
Yeah, this is responding to Helen's concern that it probably doesn't make too much sense to travel to another city just for the board meeting. It might make more sense if the community engagement to plan ahead that on the same day time, we are having this board meeting in another city. Maybe before or maybe after the board meeting, also have a community engagement, some kind of town hall meeting, let the community meet with the board member who were there present. So in combination, more than just a board meeting, that would make more sense.
That makes sense.
I would love it too if we kind of also pulled in the local CCO or a major employer in the area, or some way of engaging folks from our key interest groups while we're there. It'd be a great chance to talk to them and get their feedback on what's going on. So planning it around that as well.
And if that's going to be a whole day, it might need to be in a different date that most of us are available. Because if it's going to be more than just a board meeting, but together with another community engagement, it might become a whole day. And then you may need a different timing that most of us are available.
Michelle, did you put your hand down?
I just, as someone from a more rural community, I want to make sure that we're not, I love these suggestions. I do think that there's a tricky dynamic where places along I-5 where there are more regular opportunities for engagement, there are more people primed and ready to engage. And Eastern Oregon in particular, I think gets so few opportunities for engagement that even if we did a press release and a community engagement opportunity and worked with a large employer and a CCO, we would have lower numbers because we're building trust and building a relationship where a lot of that doesn't exist. And so I just want to make sure that numbers isn't our only metric for statewide reach. And I'm sure that, it sounds like, I think we're all on the same page, but I just wanted to say that for the record, if anyone's listening from Eastern Oregon or other parts of the state that have that sense of like, nobody comes here because they might get a smaller crowd, but that engagement might still be really meaningful and rich. So.
Yeah, to clarify, I wasn't referring at all to numbers, but it's that engagement in of itself, however large it is, as long as there are folks there who are interested in engaging with the work. Yeah, I agree with you. Small numbers are great as long as people are interested in that.
And in turn, oh, sorry, Bruce, did you want to say something?
Go ahead.
I was just kind of thinking about our previous conversation about recruitment for our next executive director and this 50-day timeline. And thinking about not putting further stress on, Jenny and Katie. Like, it seems like maybe May or June maybe would be the soonest to do. I don't know if that's right, but like, I just, I want to be realistic about,
Perhaps the committee could come up with a couple of communities that you recommend that we talk to, where we would get some engagement. And then maybe we'll start there, and then Judy and I can work with staff on timing. We can make our recommendation based on sort of which month we would pick, but we want to know sort of where we're going first and make a plan from there. Does that help too? Yeah.
Can we just go back to that slide with the groups? Yeah, I've just been thinking about it, and apropos of Diana's comments and everything else. I mean, there's a lot of things that aren't on there, but, and a couple things really shouted out to me. and that I'm assuming will be part of a next larger community engagement, but I want to get it out there. I mean, there's nothing there about historically underserved populations. There's nothing there about BIPOC communities and communities of color. There's nothing there about our 9 federally recognized tribes. There's nothing there about unions. So I've been, as I sit here and think about engagement, I'm assuming that a lot of other communities, rural communities as well, apropos of Michelle's comment, that's really part of some other process, not this. I think that's also what Diana was getting to about the limits of the contract.
Michelle, do you want to respond?
Well, one thing that the committee's discussed, Bruce, and we've had this exact conversation, is 2 things I would say real quick. One, the task force did a lot of focused engagement with a lot of those communities you just listed on, and so I think that the legislative direction was focus on who you didn't get as much focused engagement with the task force, right? So they're asking us to build on the work that you all did really well. So I think that's one piece that we're wrestling with. And so with limited time and resources, one of the ways we're trying to do both follow legislative direction and be mindful of folks who have often been left out of these conversations is we know that employers, especially small employers, is a really diverse group in Oregon. We know that healthcare workforce is very diverse. So within some of these groups that we are mandated to prioritize engagement with, can we make sure that we are being as inclusive as possible and reaching diverse folks within each of these listed groups? So that's two points that I would just throw out there.
And then I would just add, that focus is probably like one of the strengths of our committee in terms of that they are very focused on making sure that there's outreach to diverse communities and all the groups that you listed. And we did start kind of early on, Jenny, what's the spreadsheet document where?
Our engagement resource list.
Yeah, we have kind of an engagement resource list that does kind of make sure that we're identifying a lot of like community-based organizations or other groups that make sure that we are reaching out all those folks. So I think we would probably look back at that kind of as we create town halls and as we invite people to things and look at who we can get press releases out to. Local chapters of the NAACP, that's just one example, but to make sure that we are hearing from all kinds of folks.
Great. Thank you so much to Michelle and Amy for that presentation. It's really great to get a better sense of what's going on there. And thank you to Diana for joining us at this meeting too. Of course, you're always welcome. We appreciate your time and work. This is just a placeholder in our agenda that at the end of our our committee report outs each meeting, I just want the board to have a few moments to just talk a little bit about strategic direction. I think we did it well today. We don't have to do it anymore now. But as the committees give their report outs, I just want to have a placeholder so that we can think about, is there strategic direction that we want to give to the committees as they do their work to make sure that we're all aligned. And so I think that went well today and we don't need to talk about that further. In terms of next steps, we always ask if there have been any opportunities for board outreach, if anybody wants to make a comment on some outreach that they've done or have been invited to do. There's time for that now. Amy, go ahead.
Yeah, I was invited, one of our community engagement and communication committee members, Jensina Hawkins, had, prior to being on our committee last year, put on a first Eugene citywide healthcare forum and health fair, or I think it was just a healthcare forum. Then it was kind of focused on things like Eugene losing its only hospital, Oregon Medical Group, purging 3,000
patients with the PCPs and the often working on healthcare stuff. But this one, I was invited to speak on a panel along with Senator Manning, who's from our community and the chief sponsor of SB 1089. And other representatives, and including Eve Gray, who is the director of Lane County Health and Human Services, and also on whose committee, I always get confused.
Plan design.
On plan design. So there will be 3 of us that touch this work on this panel, as well as some providers and other folks, and it's March 1st in Eugene. So, you know, I will be looking for our February meeting talking points to bring into that, and just wanted to let folks know that was happening.
Excellent. Fantastic. Anyone else with board outreach opportunities or reports?
This time I'm teaching, of course, graduate personal health system finance, and I made it a requirement for our student to either participate in person or online or watch a recording in one of 3 meetings: the board meeting, finance and revenue committee, or the plan design and expenditure committee. And today, the first student came, Lido, he's a graduate student in our masters in health system and policy. And so throughout this term, you might see either some of my students coming here or participate online. And I asked them to write a reflection. I will share with you those reflections.
We're happy to help grade them too.
Yeah, thanks, John. We'd love to hear those reflections. In terms of meeting takeaways, obviously the transition of ED is going to be our big one for today. And then some committee updates. Did anyone have anything in particular they want to make sure we include in our meeting takeaways, our talking points? Okay, great. Any suggestions, ideas for next meeting topics, things we need to cover as we do our agenda planning? Yes, Joe.
Maybe not for next meeting, but I'd really like to hear more about the Washington and California plans for their universal care. It'd be great if we could align efforts or learn from each other so that we don't all make the same mistakes.
Okay.
I just want to make sure that, for those of us not on the, what are we calling it, selection committee, hiring committee, that like we get email updates or something, like, you know, the job has now been posted, that there's like an email with, you know, already drafted that we can share in our networks,
Yes.
kind of all those kind of things, and that we kind of get updated in between meetings at the key steps, if that makes sense.
Yes. That's a great point. And Courtney reminded me in our earlier discussion that in terms of us asking people to apply for this position, she recommended that we give her names. So send any names to Courtney as opposed to reaching out to your networks directly. And then she will reach out to them. It just is an added layer of confidentiality in terms of privacy meeting, in terms of public meeting laws, that she would do the outreach for us and invite people to apply on our behalf.
So that means no posting it on LinkedIn,
No, she'll do that.
no, but like us sharing it on our LinkedIn.
Yeah, sure.
So she would make a thing on LinkedIn and then invite us to share it.
DCBS will create like a visual thing with the link. And then we will make sure that you get that so that you can share it with your networks.
Okay, so that's what I was asking, like, or if there's an email with the language once it's created, that we could share that with like email distribution lists we're on that have people that are in this world.
Absolutely.
Okay. Okay, great. We do have some public comment. I think there are 3 people for public comment. Yay, because we have 6 minutes.
Exactly.
Okay, so we can get started with Mike Huntington, if you're available to come online, and just a reminder that to please limit your comments to 2 minutes or less. And if you have submitted written comment, you can be assured that we have read that.
Yes, I'm here. Thank you for hearing my testimony. I'm Mike Huntington, a retired radiation oncologist from Corvallis. I saw too many patients who delayed care because of cost. This problem has only worsened since I retired in 2006. It will change for the better only after we create a system focused on healthcare as a public service. A public service for all will prevent illness. Our current system depends on illness to keep business of our hospitals going. I'm here to urge the board to take two important actions regarding its budget and leadership. First, I respectfully request that the board publicly share its current operational budget. Transparency and funding is crucial for maintaining public trust as you undertake this monumental task of designing Oregon's universal health plan. Secondly, I strongly encourage the board to increase its budget as needed to attract top-level executive director with extensive experience in healthcare financing. Then consider that hospital CEOs who manage single facilities earn an average of $171,000 annually. To recruit an executive capable of designing entire states or helping design an entire state's healthcare financing system, a competitive salary closer to $300,000 to $350,000 may be necessary. Lastly, public testimony from January 9th expressed concern about challenges regarding ERISA, the Employment, Retirement, and Income Security Act of 1974. She may not have read the task force extensive investigation into this question. Indeed, it will make it much easier for you to create a universal healthcare system if Congress passes enabling legislation such as 6270, HR 6270, which enables Centers for Medicare and Medicaid Services to grant waivers for ERISA and Medicare restrictions. Last year, Representative Rokana introduced the bill in the House and Senator Ed Markey in the Senate. I hope everyone listening will encourage our federal delegation to support this important bill. Thank you for your consideration.
Thanks, Dr. Huntington. Alex Polikoff.
Yeah, thank you. Can you hear me okay?
Yes.
Great. I don't know if you can see me or not, but
Yes.
so my name's Alex Polikoff. I'm just speaking on my own behalf. Thank the board for the opportunity to weigh in. Michelle already actually broached the topic I wanted to discuss, which was intercommittee communications. So at the last board meeting, I suggested that one or two committee members be present at another committee's meeting when information needs to be shared between committees, and then thereby obviating the concerns about quorum. So after the board discussed my suggestion, there was an issue broached about the potential short time between committee meetings, maybe not allowing that discussion to be as a noticed agenda item, and that being a problem. So immediately after the meeting, I sent an email to the board with my own reasoning to basically help alleviate any concern about that agenda noticing for intercommittee communications. Just wanted to let you know, I never received any acknowledgement of receipt of my email, let alone any assurance that that email was passed on to the board or any of the committee chairs. So I wanted to say, I just think it's vital that the board not be seen as insulated from the public when you go about your critical task of creating this universal health plan for Oregon. So I highly recommend that all communication to the board be acknowledged, and that any routing or result of that communication be disclosed. I think it'll just help as you go along and get buy-in from the public, especially if there's things that impact, you know, board policy. One last observation: I think the board and committees continue to be unnecessarily frightened by staff about what communication is allowed under public meeting law. And I think your job's going to be hard enough without adding any additional obstacles. So thanks again for taking the time and your commitment, and for getting my input.
Thanks, Alex. We appreciate it. And I do acknowledge we did all receive your email. We appreciate it. And all committees are chaired by board members. So once the board receives the email, then that includes all the board chairs too. And thank you for that. And then who's the third one?
Thompson.
Okay, Thompson.
Thank you again for this opportunity. My name is Tom Sinsick, retired family nurse practitioner and a key author in the bill, under the bill at which you operate. I think strategic direction, very important. Keep in mind that there's a constitutional right. I'll say this every time, right? We're going to work on that that it's now ORS 751 that you're operating on, not Senate Bill 1089. And within that framework of strategic direction, to being overly concerned about what it's going to cost over comment after comment is really unnecessary at this time. The current cost is untenable. We know that. So focusing on whether the future cost is going to be untenable is really a wrong direction. And the focus on limiting services, behavioral health, dental, vision, as I heard in some of the committees, is really a distraction from just focusing on building a designable plan that meets what ORS 751 obligates. As an idea going forward that came up, which is those other services, non-medical necessary non-emergent transportation, the HRSN things, those can be parsed out into a separate place. Well, everybody in the main system should be under one plan. And there's somebody else can operate. There can be a simple system of directing people that need income-based services or some other eligibility services to another place. Going forward, you can do this work in conjunction with the regional health equity coalitions. Healthcare for All Oregon can do community outreach. We're doing it already. You can keep us in mind. We're a legitimate, not-for-profit organization. It's why this and the state law exists. And then I will emphasize that California is primarily working on the waivers. That is their bill. So that's going on. And then a mention of the budget is very important. I'm wondering whether OHA has a part of the budget in their governor recommended budget under OHA, because the current budget doesn't allow for the increase needed to cover all of the committees that you're going to need. Thank you.
Thanks, Tom. Okay, and I think we have a final comment that Cheryl submitted. Do you want to?
Should I read it?
Yes.
I have one life and one chance to make it count for something. My faith demands that I do whatever I can, wherever I am, whenever I can, for as long as I can, with whatever I have to try to make a difference. Jimmy Carter, 39th President of the United States. Rest in peace.
Is there a volunteer for the adjournment vote next month?
Who hasn't done it?
We've all done it.
We've all done it. I didn't volunteer. I asked who hasn't done it. We've all
I'm
done
not
it now?
sure. Stop me, I'm not sure. Go ahead.
I have it.
Okay, your turn. Great, so John, okay, thank you all for coming, we really appreciate it, this meeting is now adjourned.